In this section of the Intrapartum Lesson 4, we will discuss psychosocial and cultural assessment of the family and patient during labor and birth. These are the objectives for Lesson 4 that apply to this section. Psychosocial assessment. When performing an assessment on a woman in labor, the nurse should assess her general appearance and behavior as well as that of her partner. The psychosocial assessment includes verbal interaction. Does the woman ask questions? Can she ask for what she needs? Does she talk to her support person? Does she talk freely with the nurse or respond to questions? Body language. Does she change position or lie rigidly? What is her anxiety level? How does she react to being touched by the nurse or support person? Does she avoid eye contact? Does she look tired? If she appears tired, ask her how she rested lately. Perceptual ability. Is there a language barrier? Are repeated explanations needed because her anxiety level interferes with her ability to comprehend? Can she repeat what she has been told or otherwise demonstrate her understanding? Discomfort level. To what degree does the woman describe what she is experiencing, including her pain experience? How does she react to a contraction? How does she react to assessment and care measures? Are any nonverbal pain messages noted? If the woman has a history of sexual abuse, the nurse will need to assist this woman with associating the sensations that she has experienced with childbirth and not with past abuse. It is very important to understand that abuse in pregnancy is a common occurrence. An abuse screen should be done on every pregnant woman who comes into the labor unit. Stress in labor. The way that the woman and her support person approach labor is related to the way in which they have been socialized to the childbearing process. The actions of the woman in labor reflects her physical, social, cultural, and religious life experiences. Each woman may have differing beliefs regarding what is acceptable and unacceptable during labor. It is important to understand that the woman, her husband, significant other, or support person in order to help alleviate some of the stress of labor. The population of the United States is becoming increasingly more diverse. This makes it important that the nurse understand the cultural, ethnic, or religious beliefs of the patients. Nurses must provide culturally sensitive care. Many cultures do not have the father present. The practice of having the father present is prevalent with American women. Nurses need to be sensitive to the fact that this is not always the case. Other examples of birth practices of different cultures include: Somali women are stoic in labor so that no sign of weakness is shown. Japanese women labor silently and use natural childbirth methods. Chinese women have a stoic response to pain. The father is not usually present but will have a female relatives present. Indian women prefer natural childbirth methods. The father is not usually present. Mexican women may be stoic about discomfort until the second stage and then may request pain relief. Father and female relatives may be present. You can learn more about different cultures relating to birth practices in your book. The non-English speaking woman in labor presents a special challenge to nurses. If the patient does not speak English, this can greatly increase her anxiety levels as she does not understand what is going on. This leads to a feeling that she has absolutely no control. It is very important to have a translator, whether it is a support person with her, an interpreter, or ideally a bilingual nurse. Any of these can help the non-English speaking patient. You need to be aware of all of the different practices based on culture, what personal feelings about birth are, and you need to be sensitive to whatever your patient decides is best for her.